Hello, everyone. I'm David Ho. I'm currently a pain fellow at Stanford University, and I work at the pain clinic. Today, I'm going to be talking about mindfulness in pain and how that can help you with your pain conditions. Let's see. Okay. All right. So before I begin, I would like to tell you a little bit about myself. So as I said, I'm currently a pain physician at Stanford. I'm also a neurologist by training. I completed my residency in neurology. So I used to treat a lot of neurological diseases, including polyneuropathy and stroke and seizures. But I'm also a neuroscientist and geneticist by training as well. I did my genetics in my PhD, and I study a lot of genetics of pain, how genetics can affect our painful response, and how genetics can predispose us to a lot of these different neuropsychiatric diseases. Lastly, is I'll be moving to Portland, unfortunately, so I'll be out of the Bay Area. But if you do have family, and friends who is interested in seeing me, you can follow me on Twitter, and that's my Twitter number. So this is the outline of today's talk. We'll talk about what mindfulness is, why you should care about mindfulness, and how you can cultivate mindfulness for yourself. So before I begin talking about mindfulness, I want to talk about the four-legged chair model in pain management. If you have been to the pain clinic here at Stanford, we talk about this very often. So the four legs of the chairs are the mainstay of our treatment here. So one is medications. So the typical medications you take, including your ibuprofen, Tylenol, gabapentin, all the way to like topical medications like lidocaine patches, interventions like injections, even spinal cord stimulators, or steroids or radiofrequency ablations. So medication interventions, they are what we call the passive treatment. So you don't have to do anything. The doctors do things for you, and you just take things at face value, and doctors do things for you. The problem with medication interventions are that they tend to lose their effect over time. So the more you do them, over time they may lose their efficacy. And the other two parts of the chair are physical therapy and pain psychology. So for physical therapy, they usually is done by experts, physical therapists. They've done a lot of studying physical therapy. They're the experts. They'll teach you how to do physical therapy at home, and how to best manage your pain with physical therapy. And lastly is pain psychology, and that's something we want to focus on today. And pain psychology and is very useful in managing chronic pain, and mindfulness is just one of them in managing your chronic pain. So physical therapy and pain psychology, they're more active. So these are things that you can do on your own, and over time they tend to be more and more effective over time. So these four legs of the chair are important to do them all together, and then that's why today I'm talking to you as a physician about the importance of pain psychology and mindfulness. So what is mindfulness? Just take a moment, think about what mindfulness is when you first hear about this concept. I'm sure some of you probably have already heard about it. Some of you probably have already practiced it. Just take a moment to think about what you think about when you hear mindfulness. Well, I can share with you what I thought about when I heard mindfulness. So my wife turns out to be an expert mindfulness teacher. So she did her entire thesis on mindfulness. And recently she gave a talk to me, actually her job talk about mindfulness, and not about pain, but about kids and kids with ADHD. And so the first thing that came to my mind about mindfulness is meditation. So I thought mindfulness is equal to meditation. Turns out I was wrong. Well, I was partially right, and and mostly wrong, but partially right. So meditation is it's an action. It's a kind of like a part of mindfulness, only small part of mindfulness. So meditation is an action. You have to be quiet. So you just sit there, and so it's an activity through which we teach our brain how to be quiet and concentrate and be aware of the thoughts and emotions. So when it comes to mind, it's usually a person sitting there, closing their eyes, trying to meditate and think, right? And mindfulness is really a state of being. So it can be mindful everywhere, no matter what you're doing. So it's when we live mindfully, we strive to be aware of each moment, what is happening within it, and as it passes. So it can be running, you can be mindful. It can be eating, you can be mindful. You can be sitting in your chair, you can be mindful. It can be driving, you can be mindful. And of course, when you meditate, you're mindful. So meditation is only a part of mindfulness. So have you had any experience driving and Google Map tells you that you have to turn right, and then you realize you didn't take that right turn? I certainly have on multiple occasions, and I have to take a detour for another half an hour stuck in traffic. And have you also have any experience like you're taking a shower and all of a sudden, wait, did I actually wash that part of the body? I don't know, maybe I just wash it again. So that's the difference between mindfulness or mindfulness. And so when we have a lot of things going on in the world, we tend to have a lot of thoughts in our minds, and we're not focusing on what we're doing. And mindfulness is the opposite. So we focus on the things that we're doing like right now, not the things that happened before or the things that's going to happen tomorrow. So I'm going to give you the official definition of mindfulness. So that it's the awareness that emerges through paying attention on purpose in the present moment. So not before or after, not tomorrow, and non-judgmentally. So we do not judge what's happening right at this moment. So we are not judgmentally to the unfolding experience moment by moment. There are certain foundational attitudes that can strengthen mindfulness. So the first one is beginner's mind, thinking like a child. So think like a child. When you're a kid, you're curious about everything surrounding you. Like, why does the airplane fly? And there are birds chirping, why do they chirp? There are cars around us. They're curious about everything. And mindfulness is exactly that. You're trying to relearn your surrounding with a non-judgmental way, and try to learn new things about your body. Next is non-judging. So you do not judge what's happening inside your body because it's already there. It's part of your body. You're trying to learn more about it. Next is acceptance of what is happening. It's similar to non-judging. So it's happening in your body. So we just accept what it is. If it's pain inside your body, it's okay. It's part of my body, and it accepts that it's happening. And next is non-attachment. So like a kid, you go from one thing to another, and you don't attach to one particular instance. So you would not focus just on pain, but you would focus on something else too. So you don't get attached. Lastly is non-striving. And because you do not judge, you do not strive to get rid of certain thoughts or certain experience in your body. So let's talk about the typical experience or response to pain. So if you're a normal person, and it's a normal response to pain is we try to resist and ignore it. We don't want it to be there, or we ignore that the pain experience there. But mindfulness response to pain is that we acknowledge the pain is there, and we let it to be there because it's already there. We let it to be there. We do not resist, and we do not ignore. Another normal response to pain is that we are uncertain. We don't know what's going to happen. We are fear of danger, when I move, I don't know what's going to happen. I may feel pain, and therefore I shouldn't move. But the mindfulness response is that we trust and we understand. We trust that pain is a normal response, and we understand the pain. And a normal response to pain because we're uncertain, because fear of danger, we feel like we have no control. Everything's out of control. And the mindful response is that we're in control, and because we understand that we know that we'll be able to put it under control. And non-normal response to pain is that we're nervous all the time, right? And so we have a really wound up nervous system. And the more the nervous system is wound up, the more painful it's gonna become. And even long after the initial insult is gone, maybe let's say, it can be an injury, can you slip and fall? Long after that initial injury is gone, your brain is still wired to think that that painfulness is still there and you cannot get rid of it. And the mindfulness response, on the other hand, because you're in control of this pain, we relax the nervous system, and that will make the pain less, and it will relax this nervous system. And over time, that will rewire your brain. And that's what we're doing here with mindfulness. We're trying to rewire the brain so that this nervous system is not wound up. So a typical normal response to chronic pain is that we are suffering from chronic pain. So we're uncertain, we're not in control, we're nervous all the time. And mindful response is that we'll be living well with chronic pain. So why talk about mindfulness? I want to first talk a little bit about the origin of mindfulness. It's actually started a long time ago, probably more than several thousand years ago. Buddhist monks and with Buddha. So there was a folktale at the time. So there was Buddha's, I think, students ask him. So if you have one arrow that shot at you and it's pretty painful, and if you're shot with another arrow, will that be even more painful? And Buddha said, no, not necessarily. So the first arrow you cannot control. It's just shot at you. It's really painful, but it's okay. When a second arrow shots at you, you don't have to be as painful because you can control that sensation. So what it really means is that the first arrow is the initial injury.
Hey, David, your sound just went off. David?
All right, sorry about that. Where was I? It's okay. I'll restart then. So what the Buddha was saying. So if the first arrow you can control. So first arrow you cannot control, can be an initial injury, and the second arrow is something we can control. We can control the pain response to the arrow. And actually, with other Buddhist monks, they've done studies on them, and they all do mindfulness practice. Their pain tolerance is actually much higher. Well, this is this is from thousands of years ago. Who cares? But there's a lot of study done recently, and our understanding of mindfulness has changed quite a bit. It's much more advanced these days. So I just want to share with you a couple of studies on mindfulness. And in this particular study, it's an fMRI study, or functional MRI study, on the right side. So what you're seeing with these kind of curvy lines, this is a part of your brain. This is the right side of the brain, is the left side of the brain. And this varying coloring is the activation parts of the brain. So in this particular study, they look at patients or people with pain, and they're just resting, and they realize that there's activation in this part of the brain called somatosensory cortex. So typical area where you have activation we've had pain. And on the right side are people who have they're doing meditation and mindfulness, and they're also having pain. And what they saw was that there's no activation in the somatosensory cortex, suggesting that if you do mindfulness meditation, you actually reduce this activation inside of your brain. And the bottom part is also another fMRI scan showing some activation in what we call the orbital frontal area of the brain. And this area is activated more when you're actually doing mindfulness meditation, and this is associated with less pain. Same thing with this particular area called thalamus. It shows reduced activation when you're doing mindfulness. And in addition to the fMRI findings, there also evidence suggesting that mindfulness reduces blood pressure, reduces the cortisol level. These are all the things that are associated with the fight or flight response that we typically have if we have anxiety and trying to fight it. This is another study on mindfulness and chronic pain. So there's something called meta-analysis, means that we take all the studies together on mindfulness and pain and see mindfulness is effective in treating chronic pain. In this study, they looked at 38 randomized studies, so these are all very good quality studies, and look at whether mindfulness helps with pain. And so what's important to look at is you don't have to understand what this graph means, but you just have to look at this little diamond shape at the far end at the bottom of it. If it's above 0, that means effective. If it's below 0, it's not effective, or not actually negatively impacting chronic pain. So in their meta-analysis, they found out that mindfulness is effective and in managing chronic pain. You'll notice that it's not dramatically above 0. So it's not like, you do mindfulness and the next day your pain is gonna be gone. It's a small effect, but even though it's small, it's effective in treating chronic pain. Okay. So next, I will talk about ways that you can potentially cultivate mindfulness and actually practicing a little bit of mindfulness in our talk. Okay. So there are a lot of ways that you can cultivate mindfulness. You can do mindful breathing. You can breathing in and out, and you'll be able to be mindful. You can do mindful sensation. So multiple ways you can do it. You can do mindful eating, mindful smelling, etc. My wife, when she teaches mindfulness, she would let students eat chocolates and ask them how they feel when they eat chocolate. So it's a way of doing mindful eating. You can do mindful movements. You can be mindfully walking, etc. You can have mindful thoughts and emotion. Pay attention to your thoughts and emotion and see how they affect you. And as in, okay, all right. So let's practice a little bit of mindfulness. I can't pretend to be experts in this, but I'll tell you what I know about mindfulness, and then we can do a little session now so that I can have a little bit experience of it. Okay, so before we begin, find a spot that you're comfortable with. You can be sitting down, you can be laying down, you can even be walking around. It's okay. You can close your eyes or keep your eyes open. Either way is fine, but I think I would recommend that you keep your eyes closed so that it will be more effective and I'll be able to focus a bit more. So before we begin, try to prepare your mind. Think of your mind as a child's mind. Everything is new. You're trying to learn everything about your body. And whatever comes at you, just roll out the welcome mat. If it's part of your body, you try to learn from it. Okay, so let's first do a body scan. So try to feel from your head to your toe. Let's start from the head. And scan your head, around your eyes and your nose. You feel that it's naturally breathing in and out your nostrils, your mouth, and your neck. And go down your shoulder and see how it feels naturally resting. And your arms and your fingertips, how do they feel? And then we can go down to your back. Feel how it's resting, whether it's on your bed or your chair, your hips, and down your legs, and your toes. And as you're doing your body scan, you also can pay a little bit of attention to your breathing as well. Just notice how you're just naturally breathing in and out when you're doing this body scan. Naturally breathing in and out. And with every breath, you feel something new. Bring new things. It's a new start. And with every breath out, you're breathing out things that you don't need. Just naturally breathing in and out. And as you do this, you'll realize that your mind naturally wanders. It tries to escape from you. Did you try to suppress it? It's okay, you don't have to suppress it. You do not resist. We let it be. We're a kid just to try to observe our minds and our body. Why does it wander around? It's okay to let it wander around because it's your body. And if you're distracted by pain, maybe back pain, arm pain, neck pain, it's okay. You say, hey, what's going on there? Hey, I know you well. And I allow you to be here. Well, we'll work together because you're already here. You're being with me while we'll live together. And you can also pay a little bit attention to how the pain is like. When you go to a doctor's office, they ask you, how does the pain radiate? Is it sharp? Is it dull? You can do the same thing and check with your pain. And as you're doing that, you also say to it, it's okay. Hey, I welcome you to be here. And we'll work together because you're already here. And as you're doing that, and if you have difficulty focusing on that, you can always come back to this breathing. Just notice as you're doing it, even though you're in pain, your body is still breathing in and out. With every breath in new, every breath out, taking away the things that we don't need. Breathing in and out. And at this time, you may notice your emotion as well. Are you angry? Are you happy? Are you feeling in peace? Are you anxious? It's okay, let it be. If you're angry, it's okay to let it be angry. If you're anxious, it's anxious. It's okay. We're just observer. We're not trying to control it. And again, if you're having difficulty focusing on it, so always go back to the breath. And feeling every breath in and every breath out. You can repeat if you want to. You can do body scan from head to toe if you want to. Okay. So if your eyes are closed, we can open them again. So that's kind of a brief session on mindfulness. There are a lot of tools out there which I'll share with you if you want to do more sessions. There are a lot of free information and free resources that you can use. Okay, so I just want to go over some mindfulness languages for pain specifically. So you'll notice when I was doing that last session, I used some of these. So one of them is, hey, I know you're here, and I allow you to be here. So it's a part of your body. Or say, hey, you're back. I know you well. We've been living together for a long time. Or I welcome you to be here, because you're already here. Or I give permission for myself to feel this way. It's okay to feel this way. Or you can say, hey, what's going on here? And also be curious, hey, what's there? Is there something new that's different? And importantly is I am able to choose how I respond to this pain. It doesn't have to be painful. I mean, it's pain initially, but it doesn't have to be emotionally painful. And lastly, but most also importantly, that I choose to re-inhabit this body as it is. So rehab or rehabilitation is not trying to make this body brand new again, right? So I used to treat a lot of stroke patients. They stroked out, they cannot move their body. They cannot go back. It's their new body now. So you're trying to re-inhabit this body as it is. Pain may be there to stay, but you don't have to be miserable. You're trying to live along with it. So you have to choose to re-inhabit this body as it is. So what are some ways that you can practice mindfulness? We can do it formally. You can do it like we did. It can be sitting down. It can be meditation, close our eyes. You can do with an app or an online resources. But you can also do it informally. That's what I like most about mindfulness. You don't have to dedicate time to it, because you don't need time to do it. You can be cooking, you can be mindful. You can be eating, you can be mindful. You can be driving, you can be mindful. You can be walking to work, you can be mindful. So there's really no excuse to not do mindfulness and say, hey, I don't have time to do it. No, you do. You always have time to do it. You can be mindful anywhere you go. So I'll just repeat some of the things we sort of discussed. We talked about mindfulness, and that's we're practicing it. I talked a little bit about mindful breathing as well. You pay attention to breathing. It's a very simple way, but it's a very crucial way to practice, because you want to be able to anchor onto something if you cannot focus your minds. And so you do mindful breathing, and then as you're doing it, you notice your body position, and you use the breathing as an anchor. And as you're doing mindfulness breathing, you also can notice your wandering minds, like I was talking about. You can have thoughts and you have wandering minds. And you do mindful sensation. So with the body scan initially, you pay attention to your body sensation. It's a great way to cultivate mindfulness. But as we're doing this body scan, mindful sensation, we need to be non-judgmental as what it is, whether it's painful or non-painful. You can pay attention to your sound around you, what you're seeing, what you're tasting, what you're smelling, what you're touching. All these are just ways to cultivate mindfulness. And there's also mindful emotions. So when we ran through that little exercise, we did a little bit of mindful emotions. You try to notice what kind of emotions you're having right now. Anger, sadness, happiness, and you observe why your body is feeling this way in a non-judgmental way, and learn as much as your body as possible. You can also do mindful movements. You can really literally practice anywhere you are at any time. You can moving around, you can be mindful. What my wife does with the school-age children who can't sit still, who have issues with attention problems, she does this mindful movements with them because they cannot sit still. And then as they do more of these mindfulness movements, they actually are able to pay more attention to what's around them. And that's power of mindfulness. And you can do it too, not to alleviate difficulty with attention, but to help you with your pain. So I want to tell you that mindfulness really provides hope to a lot of people. So mindfulness doesn't reduce your pain just right away, reduce from the 9 to 0. It doesn't work like that. What it does is that, if you're in chronic pain, you feel like you're drowning all the time. Mindfulness sort of puts your head over the water a little bit. You're still sort of drowning, but you have hope, right? So you hope one day that you won't drown anymore. So maybe your pain is 8 out of 10 right now. With mindfulness, maybe you can reduce that 8 just to 7. So that will, you're still quite in a lot of pain, but reduce a little bit. And with practice over time, maybe the year after, if you practice for a year, maybe you'll be able to reduce that pain from 8 to 6 by 1 more point. With the year after, maybe you can reduce it by another point. And over time, you may be able to live in peace with this chronic pain you've been having. Just imagine this. So if you live with chronic pain, you may be in pain for a year, 5 years, 10 years, 30 years. And even after your initial injury is long gone, your body is rewired to think about pain all the time. And if you have pain for 30 years, your brain is trained to feel this pain for 30 years. One single injection or one medication of taking it away is very unlikely. And with one injection, your brain is already rewired. It's difficult to rewire it to take the pain away. But with mindfulness, with practice over time, maybe it's 1 year, 2 years, 5 years, 20 years, you may be able to rewire the brain. That's our goal, is to rewire the brain so that we don't feel the pain as much, and so that we'll rewire the pain and we don't feel that we're hopeless. And I want to bring back this like a chair analogy to pain management. So we talk a little bit about pain psychology or mindfulness within pain psychology. And so if we're able to reduce, let's say, pain by 20% with pain psychology, mindfulness, we have physical therapy, reduce it by another 20%. It may not be slam dunk. Another intervention reduced by pain by another 20%. And then with some medication, we can reduce the pain by another 20%. Then you're reducing your pain by 80%. And that's what we're aiming for. So we're using this multidisciplinary treatments model to help with chronic pain. We don't rely on one single thing because it may lose effectiveness. You have over time, and with this model, you'll be able to rely on each other even if one modality fails. And so it is important. So when I refer my patients to pain psychology and pain PT, patients may say, hey, I don't think they're helpful. But the purpose is not to, just to blame you on anything, but really to help you so that you can, live incremental benefits from these treatments. So in the end, I want to give you some resources on mindfulness. So there are a lot of apps, relaxation and pain management. Headspace is a great one. So it teaches some basic meditation mindfulness in just 10 minutes, and it's free. Curable, it's an app that we work with and I recommend all the time. The only downside is that I think it costs money. I think it's $5 a month, but you can get a free trial. There are also guided meditation, mindfulness, relaxation, and stress management tools. They're all free at this UCLA website and UCSC website. You can take a snapshot of it if you want to. I think it'll be useful. So you can take a moment and take a snapshot of it. And next slide, we have some free online mindfulness-based stress reduction programs, or MBSR course. you can do. If you want to find an MBSR instructor or program near you, this is the website. You can take snapshots, use your phone, whatnot. There are a lot of books on mindfulness. This book of Full Catastrophe Living, Where You Go book, and these are all very good resources if you're interested in further exploring your options